Welcome to this talk on the lymphatic system. Now, the lymphatic system is a completely fascinating system and unfortunately is somewhat overlooked on occasions. So let's take time to really think about what this system is doing and the main components of the system. Now, there are three main functions of this lymphatic system, which is distributed throughout the body. And the first function to mention is that it will drain excess interstitial fluids. So if there's excess amounts of fluids accumulating in the tissue spaces, the extracellular fluid in the interstitial spaces, then the lymphatic vessels drain this and eventually that will go back into the venous blood supply. And then the lymphatic system transports dietary lipids. Now, when lipids are absorbed from the small intestine, they can't go directly into the bloodstream because the fats won't dissolve in the water component of the plasma. In other words, the fats are hydrophobic. They will be repelled by the water. So there needs to be a separate system for absorbing fatty material from the small intestine. And that is facilitated by the lacteals in the villi in the small intestine, which are part of the lymphatic system. This material that is absorbed from the small intestine is called chyle, and that will eventually also go back into the venous circulation, albeit via the lymphatic system. And the third important function of the lymphatic system is it carries out immune responses. So the white blood cells, the lymphocytes that are responsible for the specific acquired immune response, a lot of these lymphocytes are located in the lymphatic system, hence the name lymphocytes, lymphatic system. And the combination of the lymphocytes and the lymphatic system is essential to mount specific immunological responses. So a functional lymphatic system is also essential for good immunological function. But first of all, we'll think about the drainage of excess interstitial fluids. Now, at the arterial end of a capillary, the hydrostatic pressure, that is the blood pressure in the capillary, is going to be relatively high. And this means that water molecules are going to be forcibly filtered under the influence of this hydrostatic pressure from the space inside the capillary into the tissue spaces. That is, from the intravascular space into the interstitial space. And this, of course, is important because it's where we get tissue fluids from. All cells need to be bathed in tissue fluid. It is the essential diffusional medium. We can't have the cells of the body desiccating and drying out. They must be bathed in tissue fluid. But then as tissue fluid continues to be formed, it would accumulate if there's not some way of getting rid of it, and we will become edematous. So at the venous end of capillaries, when the hydrostatic pressure has dropped, it is the osmotic pressure that sucks the tissue fluid back in. So at the venous end of the capillary, the osmotic pressure is going to exceed the hydrostatic pressure, that is the blood pressure inside the capillary, and the tissue fluid will be sucked back in. And all of this osmotic pressure is generated by the plasma proteins. So inside the capillaries, in the plasma, there are lots of plasma proteins. But in the tissue spaces, it's very watery. There shouldn't be any plasma proteins there. So that means that the water is going to diffuse from a watery area to a less watery area. And the area inside the capillaries is less watery because of the presence of the plasma proteins. So we see that this movement of tissue fluid is dependent on the presence of the plasma proteins in the capillaries, in the blood, in the intravascular compartment. But sometimes a few of these plasma proteins escape into the tissue spaces. And that's bad because that means you start to develop an osmotic potential in the tissue spaces, which would tend to retain the water, preventing it being osmotically reabsorbed. So it's very important that we don't accumulate plasma proteins in the tissue spaces. And occasionally some do escape. And once they've escaped, it's very hard for them to get back into the capillaries. So if the plasma proteins can't get back into the capillaries, we need some way of getting rid of them, Otherwise, the plasma proteins would be retained in the tissue spaces and the tissues would become edematous and we'd all go around being soggy bags of fluid, which wouldn't be good at all. So if we consider a particular tissue, as well as lots of blood capillaries perfusing that tissue, there's lots of lymphatic capillaries in that tissue as well. And the difference is that the lymphatic capillaries are blind-ended. They're a bit like the fingers on your hand. They're blind-ended capillaries. But once fluid gets into the fingers, into the capillaries, then it will drain back up into the larger lymphatic vessels. Another analogy might be land drain pipes in a field. If there's lots and lots of rain, you can't drain away the excess amount of water. So the farmer might put in some land drain pipes, the water goes into those pipes and drains away into the ditches and into the rivers. And the key difference between the blood capillaries and the lymphatic capillaries is the lymphatic capillaries have very floppy cells. The cells are able to flap back and forwards. So when there's a protein outside of a lymphatic capillary, the cell will flop open a bit like a door and let that protein from the tissue space into the lymphatic capillary. But then the cell in the wall of the lymphatic capillary will flap back and will not allow the protein back out into the tissue spaces. So in other words, the proteins can get into the lymphatic capillaries but not out of the lymphatic capillaries. So excess tissue fluid and protein will be absorbed into the lymphatic capillaries, and from there it will move away towards larger lymphatic vessels. So if you imagine, for example, some lymphatic capillaries in your thumb, excess tissue fluids will be absorbed into these lymphatic capillaries, as will any proteins that have escaped into the interstitial space. These will then drain down your thumb, through your hand, through your wrist, up the forearm, and will eventually drain into the lymphatic nodes located in the axilla, in your armpit. Now, any of these vessels that are carrying lymphatic fluid from the periphery, from say your fingers, towards the lymph nodes are called afferent lymphatic vessels. So it's the afferent lymphatic vessels that transport lymphatic fluid towards the lymph nodes. And these lymphatic capillaries drain into progressively larger lymphatic vessels. And these lymphatic vessels have valves in the same way that veins do, or in a very similar way that veins do. And these valves in the lymphatic vessels ensure one-way flow of lymphatic fluid from the tissues towards the lymph nodes. So in this respect, they have a drainage function similar to veins, really. Although lymphatic vessels have more valves and they have thinner walls. Now, as well as proteins sometimes arriving in the interstitial spaces, sometimes there can be infection as well. Now, infection is the presence of microorganisms in tissues. So sometimes you could be cut and bacteria or viruses could enter the tissue spaces. Or other times you could develop pneumonia and bacteria or viruses could be present in the tissue spaces within the lungs, or indeed any other organ which could be potentially infected. And if there is infection in any tissue, it's particularly important not to leave those organisms in the tissue, because of course they will divide. Bacteria can divide every 20 minutes or every half an hour, resulting in a very serious, localized and ultimately life-threatening infection. So any viruses or bacteria or other microorganisms that get into a tissue must be removed from that tissue if they can't be killed in situ. And the lymphatic capillaries also provide a very efficient way of getting rid of bacteria and infective organisms from tissues. So if you imagine a situation, for example, where you've cut yourself and bacteria have entered into the tissues in your thumb. Now, we don't want these bacteria to stay in the thumb because they'll cause more serious infection. What we want to do is drain them away. So in the same way that the proteins go into the lymphatic capillaries through these floppy cells in the lymphatic walls, so do bacteria. So when the bacteria is next to a lymphatic capillary, the cell in the wall of the lymphatic capillary will flop open. That will allow the bacteria to go into the lymphatic capillary. But then once it's in the lymphatic capillary, the bacteria won't be able to get out again. It'll be drained in the lymphatic flow, and it will flow up through the arm towards the lymph nodes in the axilla. So as well as draining excess proteins, exactly the same system is very cleverly used for getting rid of infection from the tissues as well. And sometimes cells in tissues can become malignant. And if malignant cells develop in a tissue, very often they don't stick to the other cells. Now, healthy cells produce something called adhesion molecules, and this means the healthy cells will stick together. But when cells become malignant, very often they don't produce these adhesion molecules. And that means that the malignant cells will no longer be sticking to the other cells. The malignant cells will start floating freely in the tissue spaces. But of course, we have this lymphatic capillary mechanism for getting rid of extraneous material in the tissue spaces. So if a cell is wandering through the tissue spaces, as a malignant cell may well do, it can come up against one of the billions of lymphatic capillaries, flop through the capillary wall of the lymphatic vessel. Once it's in, the cells of the lymphatic capillary will flop shut and not let it out. And again, it will be drained away from the tissue in the flow of lymphatic fluid towards the lymph nodes. So we can see that the lymphatic system has these important mechanisms. It's preventing the edema, draining away the excess tissue fluid. It's getting rid of infection. It's taking infection away from the tissues, and from time to time also it can take malignant cells away from the tissues as well. All of these are important essential mechanisms for keeping the tissues healthy. So we see that it's vital that a tissue contains millions or billions of these microscopic lymphatic capillaries, located between the cells in the interstitial spaces and located between the blood capillaries. It's important that once fluid enters a lymphatic capillary, that it can't get out again. Once tissue fluid enters a lymphatic capillary, it changes its name and it's then called lymphatic fluid. It will then drain away, directed by the valvular system, towards the lymph nodes. Now, we mentioned lymph nodes. These are absolutely vital to drain the lymphatic fluid which is coming from a limb or from part of the body. So from the periphery, lymphatic fluid, possibly carrying, certainly carrying proteins, some proteins, possibly carrying bacteria, occasionally possibly carrying malignant cells, will be drained towards the lymph nodes. And the lymph nodes are found throughout the body, but are more common in particular sites, as we mentioned, the axilla, but also the groin. And there are also numerous internal lymph nodes in the thoracic and the abdominal cavity. And the lymph nodes are surrounded by a capsule of connective tissue, and this capsule folds inwards, forming a sort of a network inside the space of the lymph nodes. And this results in spaces inside the lymph node called sinuses. And in these sinuses, there's a network of reticular fibers. Now, reticular is just Latin for net, so what that means is there's a kind of a three-dimensional network within the lymph nodes. So these fibers form this three-dimensional internal scaffolding, if you like, within the lymph nodes. And the afferent lymphatic vessels will drain the fluid they have accumulated into these lymph nodes. And once in the lymph node, the lymphatic fluid will then percolate through the node because of these reticular fibers. Now, living in these lymph nodes, there are all sorts of very useful viable cells, because the lymph nodes are packed with white blood cells, with the leukocytes. And as we've said, there are many lymphocytes responsible for generating the specific immune response within the lymph nodes. So if a particular virus or bacteria gets into the lymph node, it can quickly be recognised by these lymphocytes, and they can start producing antibodies which will combat that particular virus or combat that particular bacteria. There's also macrophages within the lymph nodes that are able to phagocytose bacteria and viral particles. So these immunological functions means that the lymph nodes are very, very unpleasant places for viruses and bacteria to be. In fact, they're a bit like a lion's den. Once a bacteria or virus gets into a lymph node, all the body's immunological responses will start to destroy that infection. So it's kind of a killing ground, really. All the bacteria and viruses have been drained towards the lymph node, and then the body brings out its heavy artillery, its weapons-grade material, and it's able to eradicate the infection. And most infections are eradicated without us ever realising that we had them in the first place. When this happens, we call these subclinical infections. So all the time we're being exposed to bacteria and viruses, all the time the immunological system, often mediated via the good offices of the lymph nodes, is destroying these infections before we get sick. They are subclinical infections, and we never know we have them. And indeed, we would have to consider these as a part of normal, everyday, rough and tumble type of life. And of course, all of this happens before the lymphatic fluid goes back into the blood. So this is preventing infection from getting into the blood. Now, if bacteria get into the blood, that causes bacteremia, and pretty soon after that it will cause sepsis. And if bacteria get into the blood, that's a really bad idea, because it means they can be transported, or will be transported, all over the body, resulting possibly in the development of rapid systemic infection. Whereas with the lymphatic system, the infection can be isolated and eradicated in a particular localized part of the body before it becomes systemic. Now, we can sometimes recognize if the lymph nodes are fighting an infection because the lymph nodes can become swollen. So, for example, you might have noticed yourself, if you've got a bit of a tonsillitis or infection in the throat, that you can develop lymph nodes underneath the mandible, underneath the angle of the jaw, because they are the lymphatic nodes that are draining fluid from that part of the body. And the lymph nodes can become swollen and painful for a period of time as the immune system eradicates the infection. And people often talk about this as being swollen glands. Now, they're not glands. A gland is a structure that produces something. But in the past, people have thought that lymph nodes were glands. They were actually wrong, but this saying has still persisted into modern English. So when people talk about swollen glands, they're actually talking about swollen lymph nodes in the vast majority of situations. But as healthcare professionals, we should try and avoid using the term swollen glands, and we should use the term swollen lymph nodes, which is much more accurate. Now, we've mentioned that the lymph nodes will also filter out malignant cells. Now, what happens to those malignant cells depends very much on whether the body is able to recognise the malignant cells as being foreign. If via good immunosurveillance, the immune system is able to recognise that these cancer cells are non-self or foreign cells, that they are not normal physiological cells, the immune system can rapidly kill them all. The cancer will be eradicated. However, if these malignant cells are not recognised as non-self cells by the immune system, then the malignant cells can carry on dividing in the lymph nodes, causing lymphatic spread. So once the cancer cell gets to the lymph node, we have to hope that the immune system is going to wise up to this situation, recognise the cancer cell as being an alien type of cell and eradicate it. If it doesn't, then the cancer will have spread into the lymphatic system, unfortunately. So it's interesting to note that as long as the immune system recognises that a cancer is abnormal, it can get rid of the malignancy really quickly. For example, within the lymph nodes, there are cytotoxic T cells and a type of large lymphocyte called a natural killer or an NK cell. And these are highly active against malignant cells and can rapidly destroy the malignant cells, providing, of course, they realise that the cells need to be destroyed. If the immune system thinks that the cancer cells are part of the body, then of course it won't destroy them, because the immune system is not supposed to destroy our own body tissues. Now, another clinical application here is that lymphatics can be damaged or blocked. So if lymphatic vessels are damaged, say through trauma or infection or surgery, then that can mean that the lymphatic fluid from that particular part of the body is not able to drain away through the damaged lymphatic vessels. That will mean that the lymphatic fluid accumulates in the tissues of that area of the body, causing the swelling we refer to as lymphedema. So lymphedema will develop as a result of damage to this normal lymphatic drainage system. And this can result in colossal swellings sometimes. We might even refer to this as elephantiasis, because a limb can look elephant-like because of the massive swelling due to the lymphedema that can develop if lymphatic vessels are damaged or blocked. So this means that the fluid entering lymph nodes in the afferent lymphatic vessels could contain infection, but the fluid leaving the lymph node, once it's been through this immunological defense system, should be sterile. And the vessels carrying lymphatic fluid away from the lymph nodes towards the core of the body are described as efferent lymphatic vessels. So afferent lymphatic vessels are draining into the lymph nodes. Efferent lymphatic vessels are draining away from the lymph nodes. Now, efferent lymphatic vessels join together to form larger drainage vessels called lymphatic trunks. And trunks from the right side of the thorax and the right arm, and indeed the right side of the head and neck, join to form the right lymphatic duct, which drains its contents directly into the right subclavian vein. Actually, it's the junction just between the subclavian vein and the internal jugular vein. But anyway, it means that the lymphatic fluid, once it's been sterilised by passing through the lymph nodes, will simply drain back into the systemic venous circulation. Now, lymph trunks from both legs, from the abdomen, from the left side of the head, left side of the neck, the chest, or most of the left side of the chest and the left arm, all drain back into the left lymphatic duct. And this is the main lymphatic duct for the body. And again, it drains its fluid into the left subclavian vein, again near the junction with the internal jugular vein. So again, we see that all of the lymphatic fluid, once it's passed through the lymph nodes, is drained back into the venous blood. And 2 to 3 litres of fluid are drained back into the venous blood per day via these two large lymphatic ducts. That is the right and the left lymphatic ducts. So there's a complete circulation of lymphatic fluid from the tissue spaces back into the venous blood, always going via the lymph nodes to make sure that the lymphatic fluid draining into the venous circulation, draining back into the blood, is going to be sterile, because we certainly don't want any infectious organisms getting into the blood. Now, all of the lymphatic fluid that is drained from the small intestine, containing the chylomicrons, that is the fat-containing small structures, all of these also drain back via the left lymphatic duct. So after the chylomicrons containing the fatty material absorbed from the small intestine are absorbed, they will go via the left side of the lymphatic system and still drain back into the blood. So after a fatty meal, chylomicrons will be present in the blood, but they've got into the blood via the lymphatic system, not via direct absorption via the villi of the small intestine into the blood, because it won't absorb into the blood, as we've said, because the fat molecules are going to be hydrophobic. But once they're neatly packaged in the chylomicrons, they can circulate in the blood. Now, as well as this lymphatic system, there are other lymphatic or lymphoid tissues present in the body. And this lymphatic tissue, as we've said, similar to the lymph nodes, is composed of fine reticular fibers which combine to form a connective tissue. And the fine reticular fibers often form a three-dimensional framework, just like the scaffolding present inside the lymph nodes. And this scaffolding, this reticular network, will act as a support for other tissues and cells. So the reticular fibers in lymphatic tissues support dense masses of white blood cells, that is the leukocytes, particularly macrophages. You might remember that macrophages are large phagocytic cells derived from monocytes. And also in the lymphatic tissue there's going to be large numbers of lymphocytes, as you would expect. And in addition to the lymph nodes, this lymphatic tissue is found in several other structures. And the one that comes immediately to mind is the spleen. Now, the spleen holds a reserve of red and white blood cells, and it's located in the upper left area of the abdomen, just under the left costal margin, that is below the left ribs. And the spleen contains the largest mass of lymphoid tissue, all in one place in the body. And in a similar way to lymph nodes, filtering lymph, the spleen filters blood to ensure that the blood remains sterile. So I sometimes think of the spleen as a very large lymph node, but it filters blood rather than filtering lymphatic fluid. Now, lymphoid tissue is also found in the tonsils. The tonsils are collections of lymphoid tissue associated with the upper airway, and they're located at either side of the throat and are visible through the open mouth. And if you think about it, this is a logical site for lymphoid tissue with reserves of leukocytes, as the airway is often exposed to bacteria and viruses in inhaled air. So you need some sort of potential immunological response to infections that can be in the inhaled air. And the tonsils are located under the moist epithelial lining of the pharynx. And like other lymphatic tissues, their function is to filter tissue fluids. And this means they will filter any bacteria which have infected the epithelium and the tissue beneath the epithelium. And tonsils can become loaded with bacteria. And if the tonsils become overloaded with bacteria, we get a condition called tonsillitis. Itis, of course, simply means inflammation of. Now, in the past, tonsils were surgically removed for repeated tonsillitis. But now it's well recognised that tonsillitis is a sign that they are performing their immunological function. The tonsils, in a sense, are supposed to become inflamed as they filter out bacteria from the lymphatic fluid. Now, having said that, the tonsils can become scarred and damaged as a result of infection, and sometimes do need to be surgically removed, as they can become a site of infection in their own right. But we certainly do a lot less tonsillectomies than we used to. Interesting to note that there's also lymphatic tissue in the appendix, but that's a bit of a story for another podcast. Now, as we've said, immunological drainage vessels are found throughout the body, and until recently it was believed that there were no lymphatic vessels draining the central nervous system, that is the brain and the spinal cord. But recently researchers have found that there are lymphatic vessels in the meninges, and a lot of researchers now also believe that there are lymphatic vessels in the brain itself. And in fact, the evidence that there are lymphatic vessels in the brain is now accumulating. So it's interesting that in a textbook, maybe 100 years ago, someone wrote that there are no lymphatic vessels in the brain, and that idea has been propagated. But recently, when researchers have started to look, then actually it looks like there are lymphatic vessels in the brain. And if this is true, this has got quite a lot of implications for nervous system diseases. This means that malfunction of the lymphatic vessels in the brain could be the root cause of a variety of neurological disorders, because there's a few neurological disorders where there's altered immunity. For example, you might think of motor neuron disease or multiple sclerosis, or you might think of diseases like Alzheimer's disease, where there is accumulation of abnormal proteins in the brain, both inside the cells and in the tissue spaces within the brain. Could it be that disordered lymphatics in the brain affects the immunological status, resulting in possible autoimmune diseases such as multiple sclerosis or motor neuron disease, if indeed these do transpire to be immunological diseases? And could it be that the poor lymphatic drainage of the brain caused by diseases of the lymphatics results in the accumulation of abnormal proteins in the brain? Because we know it's the accumulation of abnormal proteins within the cells and in the tissue spaces which are a major feature of Alzheimer's disease. So, some interesting research to keep an eye on.